Good evening. I want to thank everyone who is on this call tonight, and especially the three members of Congress who have agreed to join us. Chairman Takano, Senator Sherrod Brown, and Representative Luria, as well as the VA Council President, Ms. Pamela. Tonight, we're talking about legislation that we are asking Congress to pass in order to help us deal with this coronavirus pandemic. Even though some politicians think it's time to turn the page and declare it's over, we know otherwise. We know that frontline employees at the VA needs congressional actions on PPE, hazardous pay, telework, administrative leave, and new OSHA standards. And new issues are arising every day as this pandemic advances. I'd like to mention one more thing before I hand this over to our Council President, Pamela. I want to salute our AFGE members who are risking their own lives and health every day to carry out the sacred mission of caring for our veterans. Your courage and devotion inspires us all. You're not only risking your lives on the front line, but you also bravely speak out about the truth of conditions inside the VA's hospital and clinics, even after management threatens and harasses you. You're telling the truth to the American people. You are true Union heroes. And now I would like to introduce Council President Pamela. President Lee.
Thank you, President Kelley. On behalf of the National VA Council, I want to welcome everyone speaking tonight and the many hundreds listening in across the country. To the members of Congress who took time away from so many pressing demands to join us, please know how much it means to our members who are going to work every day trying to take care of veterans under the most difficult circumstances they have ever faced while struggling to keep themselves and their families safe. With your help, we can get the real story out about what the VA and its dedicated workforce needs right now and make sure they have what they need going forward. I look forward to our discussion tonight, and I will turn it back over to President Kelley.
Thank you, President Lee. I'm looking forward to this discussion tonight also. So let's get to it. As I mentioned earlier, we have Senate VA committee member, Senator Brown, joining us tonight. Senator Brown of Ohio has been one of the greatest champions of VA frontline workers during his years on the Senate Veteran Affairs Committee. He has fought tirelessly for equal collective bargaining rights for Title 38 employees. And we are also very grateful for his leadership in fighting for full staffing for the VA and for his current efforts in making sure every worker at the VA and throughout the country has the personal protective equipment they need to stay safe. Senator Brown, we know that you cannot stay for the full town hall, so would you like to share a few thoughts before you need to leave, Senator Brown?
For that, your union president called you union heroes, and I hear a lot of politicians in both parties saying, they'll say thank you to all the work, all the frontline workers, but thank you is simply not good enough. The same politicians that have failed to get you the protective equipment. The president denied that this was a crisis, denied that the pandemic existed, and as a result, we're weeks behind where we ought to be in getting the equipment to workers. But to me, you don't reopen this economy until you make sure that workers are safe. We think about hospital VA workers, we think about the nurses and the doctors, we think about the people that do the laundry, we think about the custodians and the security people, we think about food service workers, we think about bus drivers, we think about police officers and firefighters. We think about grocery store people who stock the shelves. We think about clerks in drugstores. Those are the heroes, and frankly, we don't do enough to honor them. And that means two things. It means getting stronger OSHA standards, as President Kelley has fought for, and President Lee has spoken out for, and Pam Brown in Cincinnati has spoken out for. It's so important we get the protective equipment to people. It's equally important that we pass pandemic pay. when you think about those workers I just mentioned, the city bus driver, something like 35 bus drivers have died of the coronavirus across the country. You think about VA workers, you think about nurses, you think about the custodians and the laundry people and the nurses' aides. You think about all of these workers that go to work every single day. Too often, they're paid $12 or $14 or $15 an hour. And the anxiety, the danger that you put yourselves in, and the anxiety you must feel when you come home after work, knowing potentially you could actually infect your family. So Congress, when we go back to session next week, we're all going to push Mitch McConnell, and I'm leading the charge on the pandemic pay, on the heroes bonus, with Senator Murray, the Democratic senior Democrat on the Labor Committee. It's important we fight for workers. It's important we fight for safe working conditions and all the protective equipment that this union knows you need to have, and I know you need to have. It's important we fight for pandemic pay. And I want to say one other thing about the trade union movement, that the future of this country, the future of the middle class, the future of our recovery after this pandemic is finally in the rearview mirror. The future of our country relies on a strong labor movement. I was talking to a reporter in Toledo who's a member of the newspaper union. And we were talking about, she goes shopping at two different grocery stores. One of them's a union store, one of them's a non-union store. And it's clear in the union store, workers are so much better protected because they can demand of management that they're taken care of. In a non-union store, they go to management, they often get fired. So that's what that union card means. My father-in-law carried a union card for 39 years, a utility worker in Ashtabula, Ohio. My wife, long before I knew her, when she was in high school, she will say her dad's union card saved her life because she got asthma and spent 2 weeks at the Cleveland Clinic, but had good health insurance. So my pledge, and I know Chairman Takano feels the same, is to continue to fight for this union. You honor our veterans by going to work every day and taking care of them, and you honor your country, and you're the union heroes that President Kelley talks about, and you're the backbone of this country. So that's why I wanted to join you tonight. Thank you for fighting for workers. Thank you for fighting for veterans, and thank you for fighting for our country. Best wishes to all of you. Thank you.
Thank you, Senator Brown. Thank you again. Thank you for joining us and for all that you do to support of VA workers and for all federal workers for that matter. And so in keeping it in the Ohio family, Sister Pam Brown from Cincinnati VA, AFGE Local 2031, thank you for joining us tonight. And thank you for all that you do on behalf of veterans and AFGE. Pam, let's hear your story tonight from the front lines.
Thank you, President Kelley. First, I'd like to say good evening, Senator Brown.
How are you?
Thank you so much for your leadership and support of worker rights, especially for the support of our federal employees. And thank you and your colleagues for writing the letter asking for explanations from Secretary Wilkie regarding PPE and administrative leave. I have two things I want to highlight for you today regarding the environment at the VA during the pandemic, and that is safety and exposure and leave. The VA frontline employees are unsafe, stressed, and left out of the process by management. The employees know that they can count on the union to address safety concerns. At this juncture, because we are not at the table, we hear the concerns, but we can only talk with them about taking personal measures to stay safe. We have brought to management's attention that the VA is not following CDC guidelines of safe distancing. Employees are sitting in group settings with less than 2 feet between them. The issue has been raised several times with no resolution. The best they can do is tell us to wear masks all day. We feel that the VA is more concerned with press coverage than the safety of our workers. The VA is still rationing masks, 1 per week, even to screeners who come into contact with dozens of people daily. Speaking of screeners, the training for non-clinical staff who are used for screening has been minimal at best. The only training is how to use a thermometer and how to ask 3 questions. Have you been coughing, have a fever, or shortness of breath? That's it. I've had the opportunity to observe the screeners because I am located on the first floor by the front door. Examples of things that go wrong are a veteran responded that yes, he had a cough. They took his temperature and told him he was free to go. Another time, an employee came in symptomatic, a nurse actually, who worked in the CLC, and told the screeners that his manager told him he had to come in and just to wear a mask. Employee health was notified and sent the employee home. About an hour later, the employee came back saying his manager told him to come back, put on a mask. Employee health released him to go to work with this mask on. Another employee who was symptomatic reported to work sick, and I was notified to go and speak with her. She told me she was a probationary employee and was scared she might lose her job if she had to go home. She had already been marked AWOL for calling out sick before. We convinced her that she was placing her coworkers at risk and to go home, we would deal with that AWOL later. Another nurse who was directly responsible for taking care of the COVID-19 patients became sick and was told to go home without testing. This is usually how they treat employees, to contact their personal physicians, except this employee is a veteran. And I directed her to go to the ER and demand to be tested before she left the VA. Every employee, including those in direct contact with patients who have to be quarantined, must use their own leave. The VA is not approving any other leave. This is outrageous. Not only are you risking infecting your family, but if you do not have personal leave, you're penalized. Your income is affected for potentially contacting the virus. To add insult to injury, they are changing workers' shifts. Employees understand that these are unusual times and we are willing to carry out the mission of the VA. However, not one manager has stepped up to the plate or suffered any inconvenience as a result of working during the pandemic. They're sitting behind closed doors or teleworking and communicating with employees via email or Skype. This is opposite the rhetoric of we are all in this together. In fact, we're told on a daily basis we should be glad we have a job. We need help from you in Congress to make the VA accountable to employees by following the CDC guidelines for safe distancing, to provide proper PPE consistently. The VA is starting back up their dental clinic next week. The assistants only facial protection is surgical masks. I do understand that the department head has requested face shields, but as of today, they have not received them. We need the VA to encourage employees to quarantine when appropriate by providing the appropriate leave for employees who have to make the decision to stay home or feed their families. We're also asking for testing employees who are symptomatic and even to test those at least once per season who have a fear of being asymptomatic and passing the virus to coworkers and family members unknowingly. This will cut the anxiety that we all have as we report to duty. Senator Brown, thank you for allowing us to voice our concerns. And again, thank you for everything you do for us.
Thank you, Ms. Brown. Thank you.
Thank you, Pam. Senator Brown, would you care to respond to Pam's comment? We'll
Sure.
certainly appreciate it.
I mean, I've talked to AFGE members in Cincinnati a lot, in Dayton and all over our state, and I know this VA has been far too often unresponsive. And I think that because Pam speaks for this union, because everybody that carries a union card for AFGE knows they have the union behind them, it gives her a much louder voice with management. But it also means that Chairman Takano and I need to push management of the VA. This is a Trump nominee, and this is a president who is anti-union in every way. He attacks workers. He attacks collective bargaining rights. He's opposed the overtime rule. He won't raise the minimum wage. He wants to put unions out of business, and that's why AFGE standing so strong matters, because otherwise those workers don't have any real support. in a VA where you have in the Trump administration that just never, it always sides with management against workers every single time. So Ms. Brown, thank you for speaking out, and thanks for your strength, and thanks for being such a strong, vibrant member of AFGE.
Okay, thank you, Senator Brown. I know that you may have to leave shortly from the town hall, but thank you for your leadership and the support of federal workers and all workers during this health crisis. Thank you for joining us. VA workers are at serious risk of exposure to COVID-19 every day that they report to work. It's extremely important that we actually have access to the benefits provided thus far by Congress, and AFGE is working to ensure we get additional workers' protection. Dewanda Mitchell is with us tonight from AFGE Local 1061 in Loma Linda, California. Dewanda, can you briefly tell us what you're seeing from the front lines?
Yes, hello, good evening, everyone. Yeah, this is Dewanda Mitchell from AFGE Local 1061 here at Loma Linda, California. The things that they're experiencing here at the VA hospital in Loma Linda, the first thing is that they are not giving them the correct PPEs for the employees. True enough, they're giving them face coverings, but they're not giving them the proper equipment to go out into the tents, to do, to work out in the tents. We've been getting a lot of calls for the past couple of weeks about employees are being forced to go out there to work, but they're not giving them the proper equipment to do so. Also in the pharmacy unit, there's a big thing going on where they're rationing the equipment to them. So the equipment that they're getting for the face, they're getting it once a week. That's not good enough. They need to have at least 2 or 3 for that week, because as you know, they get soiled. The little masking that they do give them, it's just not enough for them. Okay, so that's one of the bigger issues that we're facing right now at the Loma Linda VA. Also, the hazardous pay. That's something that was brought forward not too long ago. It's just that all the essential workers are getting it and selected few, not everybody that's supposed to get it. I mean, I find that that's ridiculous. It's already been brought forward about this, and it's like, what can we do about that? And another thing, telework. I'm finding out that the telework is being disseminated, of course, but the managers are basically all on telework more than employees are. And they don't even have enough equipment for them to even telework. But you find that your managers are at home being comfortable while your employees are out in the front line, and it's just not good. I mean, we need to find some other mechanisms how we can really make sure that that is being brought forward the right way, because that's not fair. If they saying that you have people that can telework, I think that everybody should have the opportunity to telework if they can. Not have the managers sit at home while all your bargaining unit employees is out there working their behinds off.
Thank you.
So,
thank you.
Yes.
Thank you, Pam. Thank you so very much.
No,
I mean, Dewanda, I'm sorry. That's Dewanda. I'm so sorry.
That's right, it's Dewanda from California.
Okay, I got you.
Yes.
I got you,
All right.
okay?
All
All right.
right.
But thank you for your comments. And, you know, we're fortunate to have the chairman of the House Veterans Affairs Committee to join us tonight, Chairman Takano. House Veteran Affairs Committee Chairman Mark Takano has represented California's 41st Congressional District since 2013. He has devoted his career to giving working families a level playing field. For many years, Chairman Takano has sponsored legislation for full Title 38 collective bargaining rights. As chairman, he works every day to ensure that the VA has the tools and resources it needs to take care of vulnerable veterans and the workers who take care of them. In the early days of this pandemic, Chairman Takano was out in the front calling for more resources to make sure the VA could carry out its mission to veterans and the rest of the country while keeping veterans and workers safe. Chairman Takano, thank you for making the time tonight, and thank you for all that you are doing to make sure that VA workers' concerns are heard during this crisis. Sir, would you mind responding to Sister Mitchell's comments?
Sister Dewanda Mitchell, thank you for sharing your concerns. you must not live very far from Riverside, where I am speaking from right now. And I want you to know that these concerns, I welcome you to bring them forward to my district director in my Riverside office, even though it's closed. I'll make sure that we get in touch with you because I want to know what's going on at the medical center that's nearest to me, which is in Loma Linda. So with regard to PPE rationing and conservation, let me say that it's been a top concern of mine since February. I've been focused on ensuring that this crisis does not diminish VA's ability to care for veterans and VA staff. But the troubling press articles and issues that you've all brought to the committee, many AFGE members, and that you have actually personally relayed to me is happening at Loma Linda, have sounded the alarm with regard to PPE supply and usage. And here's the bottom line. If VA staff get sick, they won't be able to care for our veterans. If you get sick, our nation cannot care for our veterans. That's the bottom line. And I want you to know that there was a prediction that there would be such absenteeism among the VA's employees, a huge number. That huge number has not been realized. The vast majority of employees have been showing up and risking their lives, not having access to PPE. And I salute you, as did Senator Sherrod Brown. You are truly heroes. You are putting yourselves on the line, even when you're not getting the equipment that you need. I sent a letter to the White House Coronavirus Task Force to get to the bottom of this issue, and I've pressed VA repeatedly to ensure that you are getting the protective equipment that you need to care for your veterans. And I'm not going to stop pressing for that transparency until I know that you're being taken care of. I know that you're going to work in less than optimal conditions. VA itself, the secretary himself, in the last phone call I had with him, admitted that following CDC guidelines is really not ideal. And for a while they were rationing beyond CDC guidelines because their supply, they did not have a clear view of their supply. And they began to be even more cautious. They have reverted back to CDC guidelines. And even there, that is not the optimal situation. You and veterans and the public and veteran service organizations deserve to know where supply levels are if you're going to be putting yourself at risk. And that's why my committee and I have been pressing VA for answers. Now, with regard to hazard pay, let me say that every day, VA nurses, physicians, police, and many other frontline workers put themselves at a tremendous risk of contracting the COVID-19 virus. The AFGE proposed mandate that federal workers receive hazard duty pay makes complete sense to me. We have to recognize the reality that these workers are putting their lives on the line and grant a reasonable increase of pay while at work. I'm going to continue to press that hazard pay is part of the next congressional legislation, our CARES legislation that's coming up. And teleworking. So on telework, you put the stark contrast between who has access to telework, who has access to the equipment to telework. And as you continue to perform the vital services and provide care for our nation's veterans, the Department of Veterans Affairs employees face great risk during this crisis. The department must have policies and procedures to keep all employees, not just some, not just management, all of its employees safe and healthy. And but even when VA does have these policies, the leadership of the VA must ensure that the policies are implemented fully and consistently at all facilities. The ability of VA employees to telework, to have flexible schedules, and to receive adequate paid leave is critical to prevent exposures to COVID-19. And so I want to be able to make sure that people report to my committee. I want to make sure I've been requesting all of these policies as they go out to the field. I want to make sure that there's some consistency in how they're being applied. I want to know about shortages of equipment that will allow people to telework. Certainly, people should not be being made to go to work in the non-healthcare settings. If they're in the benefits administration, they're in jobs where they can do it at home, they should do it at home. Now let me address one more topic that I don't think we covered, and that's the workman's comp issue. And you know, if you get COVID-19, if you get the virus and you work for the VA, I think it's reasonable to assume that you caught it at work. And you shouldn't have to quibble over workman's compensation. And especially if you're working in one of these frontline jobs. We shouldn't put you through the paces of a bureaucratic effort to qualify for workman's compensation. There should be an automatic presumption that your illness was work-related, so you can get the workman's compensation that you deserve and that you've earned, because you all pay into that program. So I'm going to, as we say, yield back my time, and thank you, Dewanda, and I hope that we'll hear from you soon.
Thank you, Chairman Takano. Stacy Shorter from AFGE Local 2328 in Hampton, Virginia, is with us tonight and would like to share her story from the front lines of this pandemic. Sister Shorter.
Hi, President Kelley. Good to see you.
Good to see you.
So at my facility, one of the biggest issues is lack of PPE. And there seems to be this false narrative that whoever needs PPE can get PPE. Well, that could technically be true if you are saying the only people who need PPE are, for example, doctors and nurses and COVID patients. Here's why that's a problem. We've had an outbreak among the staff, and it wasn't doctors and nurses treating COVID patients that got sick. It is our social workers. It is our addiction therapists. We have, on March 18th, when the director started doing town halls to address how we could kind of handle this virus as a hospital, staff were told to not be worn while you were walking around the hospital. This sends the wrong message to the rest of the patients and the rest of the staff. So that was March 18th, when we had no infected employees, at least none that were diagnosed. So fast forward to April 1st. I'm getting text messages from coworkers telling me that they've tested positive. At that time, we still were not being issued PPE for whatever reason, I don't know. When the union sent out an SOS, hey, we need PPE, staff are desperate, can anyone help? The agency responded, this information is incorrect at this time, and we have made no notifications to the union. That statement is halfway true. It is true that they made no notifications to the union. It was the staff calling myself, calling my local president, Dr. Elliott, and saying, what do? I just tested positive. Fast forward again, we've got 5 positive staff on April 1st. On April 3rd, there's another town hall where it's brought up that folks who discuss what's going on with lack of PPE, positive staff, etc., are going to be subject to discipline. And we were told by management, we're going to have to lock this information down, and then it's going to be a lot more difficult for us to all do our jobs. On that same day, April 3rd, we were told we have plenty of PPE. It's going to ICU, 3 East, the emergency department. That's not where our staff got sick. You cannot just catch coronavirus or COVID-19 in the emergency room. It's everywhere. It's throughout the hospital. It's in building 14. It's in the domiciliary. These folks eat in the canteen. They go to the break room. We all share the same bathroom. We always share the same copy machine, you know? At that time, April 3rd, we were at 15 positive staff. On April 11th, the union was able to collect donations from the community of PPE. Why? Because we asked for it. We said, we told the truth. We're short on PPE. Can anyone help? The community rallied and said, yes, we've got you. So we got surgical masks and N95s, 3D printed face shields, 175 of those. And we brought them to the hospital, emailed leadership and said, hey, we got all these donations. Leadership denied us the opportunity to email that out to our members because of an executive order from 2018 that they decided to implement in the middle of a pandemic, saying that we cannot use government emails for union business. I asked for just an exception related to information that could keep people safe about the pandemic, and I was denied. I was not able to email folks and tell them, we have the PPE you are begging for. We're now at 18 positive staff. I just expect it to continue to double. Now, the hospital is taking donations of cloth masks. But it doesn't make sense to say we have all the PPE we need and then say we're going to give each staff member who's not providing direct care they're not identifying that correctly. But if they are taking donations from the community, then clearly they don't have adequate PPE. The enemy of my enemy is my friend. The enemy is COVID-19. There's no reason why leadership and AFGE can't work together to keep people safe. But it's just not happening.
Thank you. Thank you, Sister Stacy. My sentiments exactly. Okay. But I'm honored to have on with us tonight Congresswoman Elaine Luria, who represents Virginia's 2nd Congressional District and brings 20 years of experience as a Navy officer to her work as a member of the House Veteran Affairs Committee. Congresswoman Luria serves as chairwoman of the Disability and Memorial Affairs Subcommittee that oversees VBA regional offices. We are grateful for all of her efforts to ensure safety and fair treatment of employees at the Hampton Road VA Medical Center and for VBA and VHA employees across the country. And Representative Luria, I'd like to ask your thoughts in response to Sister Shorter's comments.
Well, thank you so much for allowing me to join you this evening, and Chairman Takano. It's great to see that we have members from coast to coast and Senator Brown in the middle of the country. So for everybody from AFGE who's listening, know that members of the House and Senate from across the country are very concerned about the issues that you're raising tonight. And Stacy, it's great to see you. I know that we're seeing each other virtually, but we're not that far apart physically. And thank you for the work that you and Dr. Sheila Elliott do and continue to do at the Hampton VA, and your great outreach and communications to our office to keep us aware of what's going on. We have tried to interface and be as proactive as possible with the leadership at the Hampton VA. And I try to come as frequently as possible to visit. And I know when this first started, kind of before the lockdown restrictions of the stay-at-home orders, the prohibition of visitors within the facility, I was able to stop by, visit with the director and tour the facility and talk to a lot of employees, many of whom I assume are AFGE members who really count on your advocacy and leadership. And I've had a chance as well to do an AFGE call. Dr. Sheila Elliott, the local president, was part of that call and shared some of these concerns as well. So, it's very concerning, the PPE issues. It's very concerning the inconsistencies in the tools that people are given when asked to telework. Obviously, this was something that was implemented quickly. People are being asked to telework who don't necessarily have the tools and equipment provided by the government to do that. And I know that's especially challenging in this current environment as well, where on top of that, they are at home, some of them with small children who are also attempting to do schoolwork and, without having the tools and equipment, computers, tablets, other ways to stay connected to do that work. And if you're doing official government work, you should be provided the tools from the government to do that work. So I've had several concerns about that issue, and also hear the concerns, and we'll take this back as well, about the inconsistencies of people who present with symptoms and people who have been told that they've tested positive, but having to use their own leave. So, the intent of any of the legislation that we've passed within Congress has really been to protect the worker and to protect the workforce. If someone is sick, the word has been, if you're sick, you need to stay home. If you think you're sick and you're going to infect someone else, you need to stay home. And that's the whole point of the social distancing. So it is discouraging to continue to hear stories from the front lines where those policies are not being implemented uniformly or truly in a common sense way. And so we will continue to stay connected with you, Stacy, with Dr. Sheila Elliott, and my district director, Dave, I know is frequently in communications with the director at the Hampton VA, and we really appreciate what you do to advocate for the workforce there. And we know that when there's an issue, you'll give us a call. You know how to reach us, and we love to hear from you. So thank you again, and it's good to see you and everyone else who's participating in this forum, and also to join together with Chairman Takano. Really appreciate the remarks that he made, and know that on the Veterans Affairs Committee, we are working hard to make sure that we provide good health care to our nation's veterans, and that we have a good workplace for those who treat our veterans at the VAs around the country. And you are very important to our country, to our veterans, and we really appreciate everything that you do. So thanks for letting me join you and letting me listen in tonight, and I will turn it back over to the next speaker. So thanks.
Thank you, Representative Luria. We cannot stress enough the importance of adequate PPE in keeping workers safe and also slowing the spread of this virus. Our last story from the front lines is from Sister Linda Ward-Smith from AFGE Local 1224 in North Las Vegas. Hi, Linda. How are you tonight?
Hello, everybody. Good afternoon. My name is Linda Ward-Smith. I am from Las Vegas, Local 1224. And I want to say thank you guys for having me on tonight to share my story. It sounds like the VA takes a playbook, all of our a play out of the same book, because all of our stories sound the same. But there's a couple of issues that we have in Las Vegas that is very concerning to me. The first thing is the testing of our exposed employees. And the employees we have 23 positive employees right now and 65 that they're tracing. The part that concerns me is the tracing, because as we know, people who don't show symptoms could still be spreaders. So our numbers keep growing because they're just told to come to work. And if you don't have symptoms, you still work. And I get that, but in this day and age right now with the new science, we do know that, if you come in close contact with somebody, you could be exposed, and you could be exposing others if you're not testing. So that is a deep concern for all of our employees. And then the majority are not direct patient care. So we have office employees who really should be teleworking because they can do their jobs at home. They're sitting in cubicles close to one another, and they're becoming positive. So then when they go to file that workers' comp claim, the first thing that they say is, well, they're not in a high risk job, so the possibility of them being exposed at the job is very low. This is a community spread. Well, that's not true, but it's very hard for us to fight that right now with what's on the table because they work in an office space, but they're getting exposed. So our employees, we have high-risk employees who have preconditions, medical conditions that they should be at home, and they're having to fight to get home and telework. They have jobs, they can really be at home. And what the manager told me was that if they go home, they will not work. So, you know, we have to have trust for our employees that in this trying times, that they will do the right thing, especially if they're sick. So that's just one of the things. And then another thing is the leave. When they do get sent home, they're told to either use their own sick leave or they become AWOL. I have one employee who actually went to the media because she had an over 100-degree temp. She felt like she was exposed, she was sick. Her manager told her to take Tylenol and continue to work. That is very, very upsetting. And she has twins at home, very young babies that she felt like she didn't want to get them sick. The manager had no compassion. She just said, stay at work, take Tylenol, and you'll be fine. Well, mind you, the majority of our telework equipment and teleworkers are our managers and our supervisors. Now, they're calling from home to check on their employees who are in cubicles at work. That makes no sense to me. So, you know, I can just go down the list. It sounds like we all have the same issues, and it just burns me up when our secretary gets on TV and say, oh, we have no problems. That, to me, is just the most dishonest thing you can ever do, and it's just a slap in the face to our employees. So I thank you for your time. I thank you for allowing me to share my story, and we hope that we can create change by having this conference tonight. Thank you.
You know, the need to ensure the ability to telework during this crisis cannot be overstated. Thank you, Linda. Chairman Takano, would you like to share your thoughts on this issue that Sister raised?
Sister Linda, can you tell me more about the office workers who work in cubicles? What kind of jobs are they doing? They're obviously not doing direct patient care, but that's not non-direct patient care. And are they, what is the policy on those workers wearing PPE?
Okay, thank you. So I can go down the list. We have employees who work in Office of Community Care who their job is to follow veterans via consults, computer management. Their job all day is to talk on the phone and work on the computer. And then we have telephone operators, low-grade telephone operators who are actually sitting in tight office spaces answering the phone. Those employees I know can have a setup at home with a phone and a computer, and they're even asking if they can use their own technology, if that's something they can do, and they have been told no. Those positions, I believe, should be home and can be at home working. We have telehealth nurses who their job is to telehealth, but they have to come to work. So those are just a few samples. So right now we are being told to wear a surgical mask. Everybody, we went 100%. Everybody who walks in the building has to have on some facial covering. So that's where we are right now.
So everybody is being required to wear some sort of mask or face covering.
That is correct.
All right. Well, that's reasonable. I would like to know. I will ask management why such employee. I can understand that you'll let them use their personal equipment. I have the computer I'm working on, which is my personal computer, but when we're doing official house business, I have to use a house issued computer with all sorts of software on it that protect it, from hackers and that sort of thing. But I am almost sure we gave the VA a lot of money to enable teleworking to happen. I don't know if they're facing supply shortages of equipment that will facilitate workers to be at home. Of course, I think it's much safer for, look, the House of Representatives, I've ordered my whole staff to stay at home. We do not have staff at my district office or my DC office. They are all working telework from home. And to the extent that people can be doing this, they should be doing that. So anyway, I appreciate President Everett, Kelley, the opportunity to ask her that question.
Yes, sir. Thank you, Chairman Takano. And I would also like to ask if Representative Luria would like to share her thoughts on this.
I echo exactly what Chairman Takano said. I think that in every case where it is possible for people to telework, to follow in Virginia, for example, the governor's guidelines about social distancing, and don't get me wrong, the work that everyone at the VA is doing is essential, but there is essential work that can be done in safe conditions. And I think that when people are doing jobs where they're not interfacing directly with VA patients, and it consists of computer and telephone work, we as Congress have provided resources to the VA to give them the tools to enable that. And we will continue to encourage them to use those resources towards that objective of making it possible for the most number of people practical to telework. And like I said, I've heard direct stories related to this from our local AFGE members and local VA employees, and we will continue to advocate for that. And I'm sure with Chairman Takano, we can check in with the VA and see, have you used all those resources to buy the computers and devices to connect to the internet, and do you need more? And that is, sort of our challenge with the lack of what I feel to be an effective two-way communication, with the top leadership at the VA on some occasions. But, my office can also, reach out to Secretary Wilkie and his staff to find out these metrics, what else do you need from Congress to make this a safe workplace for all of our VA employees? And we'll work together, Chairman Takano and I, to continue to push for that. So thank you for highlighting this important issue.
Thank you, Representative Luria. Now, there are so many important issues that we could continue for hours discussing, but I want to be respectful of everyone's time. I think this is the beginning of many discussions during this crisis. I would now like to ask Chairman Takano to provide a few final remarks.
Thank you, President Kelley. Let me also just say how fortunate the Veterans Affairs Committee is to have Representative Luria as part of our membership. She brings such credibility as a former commander of a naval surface vessel, and I know that she had huge impact on an issue recently with the aircraft carrier that is now in Guam. And raising questions about how that commander was relieved of his command. So I thank you, Representative Luria, for all that you do for veterans and for what you still have to say with your voice about our national defense. I want to thank AFGE for having me tonight. It's an honor to hear directly from AFGE members working across the country at VA facilities. I want to thank you for the heroic work that you've done to care for our veterans, and you are heroes for all the reasons we've stated before. Despite the challenges, the personal risk, you have all stepped up and continued working throughout a pandemic to ensure that we can continue to provide high quality care and benefits to those that served our country. You all give me hope for our country as we respond to this crisis. Your commitment and dedication and continued service are truly inspiring. Now, I'm pleased to see that despite social distancing, we are finding new ways to gather and connect, including tonight's virtual town hall. COVID-19 has changed everything. Every American is affected, and America's veterans are not immune to being affected. And given VA's unique role, its fourth mission, pledging to serve as our nation's backup healthcare system in times of emergency, this pandemic has challenged the very way that we care for our veterans. Now, as chairman of the House Veterans Affairs Committee, it is my responsibility to ensure that VA has the resources and is taking the appropriate steps to care for our veterans and support VA staff throughout this crisis. And here's the bottom line. If VA staff get sick, they won't be able to care for our veterans. And let me say that another way. If you get sick, our nation cannot care for our veterans. And that's why I will do everything within my power to ensure that you have the tools, the safeguards, and resources you need to care for our veterans. And most importantly, that you can do so safely. Now, I want you all to know that I have heard you, your stories from the field, your calls, your concerns, your letters. AFGE has been a willing partner with Congress and has been instrumental in my work advocating for VA staff and veterans. And because of calls such as yours, I've pressed VA for much needed transparency and action to ensure that you have the personal protective equipment that you need. And I'm not going to let up until our frontline workers have adequate protection. Recently, I worked with other House committees to propose legislation that establishes a presumption standard so that VA employees who test positive for COVID-19 are entitled to workers' compensation. With your concerns in mind about VA's telework and paid sick leave policies, I will send a letter to Secretary Wilkie soon to get answers and ensure these policies are implemented correctly, consistently, and fairly. Every day, VA nurses, physicians, police, cleaning staff, and many other essential workers put themselves at risk of contracting COVID-19. And many of you have accepted this risk because you believe in VA's mission. However, this risk should be recognized, which is why I will continue to press for hazard pay for essential federal workers on the front lines as part of the next congressional legislation to address the COVID-19 crisis. Now, I also want you to know that I will continue to press the Secretary and all the VA leadership to communicate with the union. There is no excuse for not communicating with the union and not seeing the union as a partner and an ally during this time of a pandemic. We are all in this together, and that means union workers are part of the solution, not the enemy. So in this time of uncertainty, I want to thank you for your advocacy, for your time this evening, and most importantly, for your tireless commitment to serving our nation's veterans. God bless you and Godspeed to all of you in the work that you do for our veterans in our country.
Thank you, Chairman Takano. Thank you very much for your comments and your remarks. Now, earlier tonight, I spoke of the heroism of our AFGE members on the front lines who are simultaneously caring for veterans and speaking out to tell the truth about the way the VA was and remain unprepared to provide all necessary care for veterans and to protect its own workforce. We have some other heroes on the call with us tonight, and that is our three lawmakers who are leading the way in getting us legislation to guarantee things like PPE, hazardous pay, safety leave, new OSHA standards, and the right to continue telework. These leaders shouldn't have to fight so hard for these basic things to protect the federal workforce, but unfortunately, they do. And we have to fight right alongside them to get these bills into must-pass legislation. Chairman Takano, Representative Luria, Senator Brown, who had to leave, I thank you for being with us tonight and for your leadership and your devotion to our union members. I thank the AFGE leaders who participated and everyone else on this call. And most of all, I pray for the healing of all of those who are ill, the safety and well-being for all who are caring for the sick and who are grieving for those lives that have been lost. God bless you all and good night. Thank you.